Hi, my name is Christine Evans. I'm the ward manager on the Neuro Rehabilitation Unit in East Portobello Hospital. It's become such a fantastic way forward for nursing in that it's clear, concise documentation. There's no room for error. It highlights all the risk assessments that we need. It's easily accessible for everybody, all the MDT, physios, occupational therapists, speech and language. Anybody can access the WNCR at any time, and it's become a real valuable piece of equipment for the nursing staff.
It's changed how I work because everything is in one place. You never lose a bit of paper and you don't have to run around the ward looking for something.
I think it's better to capture all the information with the patients as well, so you can go through everything in one go. So it definitely saves time, and I think it's better for patient care because it means we can spend more time with them than completing paperwork.
It's a lot easier. All the information's at the touch of a button, all the risk assessments are there, and we can read everybody's writing.
The system's been quite easy to use. We were given a lot of support and reassurance from the IT department when we first got up and running, and the access to it is quite easy to navigate once you get used to it.
Using the computer to input patient notes have been very beneficial. On a personal level, I'm dyslexic and I find it very difficult with my spelling, so it takes me a lot longer to write my notes. But using the computer format has eliminated that problem, so it's levelling out the playing field a bit really, and actually enabling me to speed up my notes because I'm not having to Google how to spell everything. So it's much easier. And it also makes it easier to understand other people's notes because everyone's got different ways with their handwriting, so it just makes everything clearer.
Hi, I'm Trudy Young. I'm the tissue viability nurse here at Velindre. For me, the important thing is about the pressure ulcer risk assessment we use at Velindre, which is a Purpose T tool. The Purpose T tool is part of the risk assessment suite on the WNCR, and what I like about it is that staff, when they're completing it, cannot submit it unless it's completed in full. So where in the past when we used the paper versions we had errors and omissions, this doesn't happen with the Purpose T, and that's absolutely superb. Also for me, for audit purposes, I can look back at the scores, look at the equipment being used, and it helps me to give a picture of what's happening to the patients on the ward in relation to their pressure ulcer risk assessments. It's a great benefit to me.
Hi, my name's Peter. I'm a staff nurse working in Brecon Hospital. We've been using the WNCR digital records for about a year now since it first started. I must admit I find them very useful. They're very easy to use. I like the way that the assessments are graded in a traffic light scheme, so you can see which assessments have been started, which ones have been completed, and which ones need some work doing to them. The other main feature that I like and I use quite a lot is the search facility within the inpatient notes. So if I'm searching for something like a reference to maybe a social worker, you can just set the filters, isn't it? And like search for social worker, and any entry that includes those words will pop up. The access you can grant to temporary users is also very useful. And we find that very good for adding student nurses on for their placement when they're on the ward, and then we can just countersign anything that they put in.
Hi, I'm Naomi. I'm a first year student and I've been using the Welsh nursing care record that's just been brought in on the ward. It's been a really useful tool for us all. I think all the nurses would agree that it's really simple to use and it's really easy for us all to share information and work together.
Hi, my name is Jane Brady and I'm the Senior Lead Nursing Informatics Specialist for Bedford Cadwallader University Health Board. For me, we're at a very exciting time in BCU currently, and the feedback that we're getting currently is that everybody's really excited about it and feel that it's been such a long time coming that they can't wait to get going.
Hi, my name's Phoebe. I'm a student nurse at Bangor University. I'm currently on placement at Wrexham Myler Hospital. So last week I was introduced to the WNCR programme and I think it's amazing. I've already started writing my own notes and I think it's great that all the information you could need is in one place. and I think by the time it's fully rolled out and all the information's on there, it'll be amazing.
I am Alison Williams. I'm the Dementia Activities Nurse. I feel that these tablets will really help in my job for all the information I need for the dementia care pathways, and that it'll be all in one place.